And that should be the end of the percussion. There will be a kidney percussion test. That is called Murphy's punch. We usually do that at the end after palpation. Okay, so we will do that at the very, very end. The next comes palpation, and again, there's several areas that we're going to palpate, first starting with general palpation. General palpation is usually done in 2 steps, meaning a light palpation, which is down just about 1 to 3 centimeters, which is just about 1 inch, and then deep palpation, which is more like 1 to 3 inches, 2 to 3 inches deep. And again, he's going to be ticklish, so I can put his hand on his belly, on his stomach, and then my hand will be on top of his, so it'll cut down on the ticklishness part of this. The other thing is too, because this can be fairly invasive and can elicit pain in some patients, I want to go ahead and watch his face to make sure he's not in any pain as we do this. So I'm going to put your hand here, and I'm just going to go off like that. Is that ticklish at all?
No.
Okay, and we're just going to move it around. Okay, how about that?
That's fine.
Without you being ticklish, I'm still
Not
okay
bad.
with it. Okay, and you'll notice that I'm doing a kneading, just sort of rubbing, pretty light area, and he doesn't seem to be in any pain at this point, and he's not ticklish. That's good. Now we're going to go a little deeper, and again, on this one, you usually want to put your hand on top of your other hand, and we're going down pretty deep. You can roll it around and feel everything. You're not ticklish at all? Good. And you're feeling for any kind of masses, any kind of muscle tightness, guarding that you may affect. You may even feel some stool. You'll feel the intestines. And you may even feel a full bladder. And in the beginning, when you start this, it's always good to have your patient empty their bladder first. Any of that sensitive at all? Okay, great. So we went ahead and did the general. Now we're going to palpate the edge of the liver, which should be nice and smooth. There's several ways you can do this. One, first of all, you want to find the edge of the bottom of the rib cage, which is right here. You can use this part of your hand, and I can come back up with my other hand. Okay, lay that back down, and this I sort of sandwich him up. And again, you're going to do breathing instructions, and you will feel the liver edge come down and bump this part of your hand. So go ahead and take a deep breath in, out. When he goes out, you can go back under, again, in, okay, and out. Good. All right. There's another way you can do this called the hooking method, which you come under your, with your fingertips under this way, and you do the same way, have the breathing instructions. The next thing is the gallbladder, and the gallbladder is sensitive to many people. So again, on the gallbladder, you're just going to go in with your fingers up under the liver in this angle, because that's where the gallbladder is, right about here. And again, I'm going to watch his face and tell me if this starts to get painful. Okay, take a deep breath in, out, come up underneath, in again. Any pain? Okay, good. All right, so we did gallbladder. Okay, I would do the same with the spleen, especially if I know it's not trough space. And if you did the spleen, you would be coming in at this angle, coming up under his rib cage, and again, you're going to have to go way up because it's tucked way up under here, so that we're not going to do that, okay, on the spleen. And the next part is going to be the trapping of the kidneys. And the right kidney is easier to feel than the left kidney. And so on this one, you basically are going to put your superior hand under his back, right along the spine at the costovertebral angle, where the 12th rib meets the spine. Okay, and then your other hand is going to be right next to his umbilicus in this area. And again, I'm going to sandwich him. And the kidney, when he exhales all the way, exhale, I go in, now inhale, you feel it come down. Okay, exhale again, and it'll slip back out. Okay. You can do the same thing on the right. Again, I would be just going like here with my hands. Okay, take a deep breath out, in, okay, out again, okay. And do that. So you can do the right kidney. That's how you would do left kidney if you needed to do that. Okay. The next one is the assessment of the aorta. And again, we go up just a little bit of superior from the umbilicus, and put your 2 fingers there. You got to press down and feel it beat. Keep coming out a little bit. Until you no longer feel it beat. Okay? And that should be 2 to 4 centimeters, up to about 1.5 inches. We listened first when we did auscultation, so I made sure he didn't have a AAA. So it's still okay to go in and do that move at this point. All right. Okay, and the next one is the McBurney's and the Rothsings. McBurney's is done for appendicitis. So if you think they would have appendicitis, you would always start on the left-hand side first. So you find his ASIS, umbilicus, and you go straight down, and you basically go in gradually and then up quickly. And Rothsings will give a rebound to the appendix if he has appendicitis. If it was still clear, we can still do the other side. Where the appendix is located is called McBurney's point, which again is between the umbilicus and the ASIS. Again, you go down slowly and then up quickly. Okay. No pain with either of those. All right, and then the last one we're going to do is Murphy's sign. Okay, Murphy's sign is going to be, again, checking. Can you sit up a little straighter? There you go. You find the angle of the ribs. You come behind at this point, put your hand flat, and then give him a punch, enough to make him go forward and not off the table. Okay, any pain with that?
Nope.
Any pain with that?
No.
Okay, everything looks good, and that should conclude the abdominal exam.